Hey, what's up guys? Welcome back to a new video, and today we are going to talk briefly about a condition known as gas gangrene and how does this condition occurs and what are the signs and symptoms of gas gangrene, and also how we can diagnose it, and what are the risk factors and the treatment, everything. Now let's see what is gangrene. And gangrene is basically the death of body tissue, and it can be any parts of the body. It can be legs or arms, in the abdomen, anywhere, and it is mainly caused by a bacteria known as Clostridia. So clostridial micronecrosis, it is a condition, and it is also a type of gas gangrene. During this there will be destruction of muscles, and it is fast spreading condition, and it is potentially life threatening form of gangrene. It is caused by bacteria Clostridium. The infection causes the toxins to form in the tissues and cells and blood vessels of the body. So basically this bacteria will release the toxins that can cause tissue death and release of a gas. These toxins basically it enters into the cells, blood vessels, muscles, everywhere, and it can damage the tissues. Most of the gangrene infections that occurs in the situations where the open wounds from an injury or surgery is exposed to bacteria. Non-traumatic gas gangrene is also possible, but it is more of a rare form of gas gangrene, and it can usually develop when the blood flow to the body tissues is compromised and bacteria get inside. There is a greater risk in people who have a peripheral vascular disease or atherosclerosis or diabetes mellitus. Gas gangrene can also occur anywhere in the body, but it is most commonly affects the arms or legs. Common symptoms of gas gangrene it includes increased heart rate or tachycardia, fever, and hair under the skin. The skin in the affected area also become very pale, and then later it changes to dark red or purple. It's due to the actions of the bacteria. These common symptoms it usually develop 6 to 48 hours after the initial infection and progress very quickly. Now let's discuss about etiology of this gas gangrene. So Clostridium species that produce more toxins and exhibit higher degree of virulence than any other bacterial taxon. So virulence it is the ability of the organism, here it is bacteria, to infect the host and can cause a disease. Clostridium infections are usually opportunistic. That means it does not occur in normal people or in normal conditions, and occur in the individuals with serious pre-existing medical conditions, as we already told in case of the people who had like some kind of injury or trauma, and also after a surgery there will be open wound and the chance of infection is very high. So virulence factors, these are the substances that produced by the bacteria in order to damage or destroy the host cells, and which can help them in surviving in the host. So in case of Clostridium they have also virulence factors, and common virulence factors that is associated with gas gangrene it includes alpha toxins and theta toxins. So Clostridium perfringens bacteria it causes 80 to 90% of infections and produces both of these toxins. So these are the virulence factors that basically cause damages in the host. That means like damage of the tissue, cells, and other parts. Now let's talk about pathophysiology, or how this bacteria cause infections in the host cell. So first, this Clostridium bacteria it enters the injured tissue. After that they will produce some kind of spores, which then enters into the blood vessels and which will be available in the circulation. These spores later they will go into different anaerobic tissues that is present in our body. they will grow and ferment the muscle carbohydrate, and later these toxins and enzymes are produced from these muscles and other substances, that is from the host. After that, there will be production of enzymes like lecithinase, collagenase, permease, hyaluronidase. These enzymes that can digest and kill the host cell and extend the anaerobic environment. So these are the enzymes that is produced by the bacteria Clostridium, and later on these damaged part of the body, for example it will be some tissues which will produce gases and destroy other tissues that is nearby. Now we go on to the symptoms that is seen during gas gangrene condition. So in this picture we can see like some kind of symptoms, for example reddening of the skin and foul smell, discharge and discoloration which turns into brown and black color of the skin. A multitude of symptoms is associated with gas gangrene, but distinctively this black lesions on the skin appears in the form of a bubble, because inside this bubble there will be like gas and gas producing bacteria. And the symptoms that is shown by the person, these are like it is not specific, but in the localized region we will see the black lesions. It is a specific symptom of gas gangrene, and skin discoloration will be seen, foul sweet smelling discharge from the lesions formed. So there will be very bad smell because of this gas that is produced by this bacteria. Distinctive black bubble lesions on the skin. There will be necrosis, fever. Necrosis means like permanent damage of the tissue. We can't bring these tissues back into normal condition. There will be also some other symptoms like pain in the following site of the surgery or trauma. The patient will also have lightheadedness, that is due to the presence of this gas gangrene and infection. Then there will be rapid heart rate or tachycardia, which means the pulse it will be more than like 90 beats per minute. Then there will be numbness on the affected region because of necrosis of the tissues. There will be formation of blisters as seen in this picture. There will be blisters, that means swelling on the skin, and inside there will be gas and also like fluid. There can be air in the subcutaneous tissue that can cause edema. Subcutaneous tissues are the tissues that is present beneath the skin, and there will be swelling. As I told, there will be jaundice. It is basically due to destruction of erythrocytes by this bacteria. Now we move on to the diagnosis of this condition. So diagnosis, there are like various diagnosis methods can be employed in the diagnosis of this gas gangrene, but the main diagnosis it can be by physical examination or just by looking at the wound by seeing the necrosis and other symptoms like foul smell and this blisters with the gas inside. So we can see and diagnose this condition. We can also use some kind of like other treatments. For example, X-ray examination can be done. We can also do like biopsy of the affected tissue, that can give exact reason of the necrosis. Then there can be, we can also do cultures of the fluid from the infected area. As I told, these blisters that contain the fluid, so we collect this fluid and we will do the bacteria culture and we find the exact bacteria that caused this condition. We can do MRI examination to visualize this necrotized region under the subcutaneous tissues, and also X-ray examination. We can also see the necrotized region in the affected tissues. Also we can microscopically identify the strain of bacteria. So these are the main methods of diagnosis of this gas gangrene. In this picture we see X-ray examination of a person who is having gas gangrene in the leg. As we all know, like this gas gangrene, they have very poor prognosis because it can't be diagnosed very early, because this myonecrosis or like change in the color of the skin, these symptoms they will appear very late in the late stages of the disease as compared to other symptoms, that is like fever, lightheadedness, headache. These symptoms that are usually seen in all other bacterial infections also. So we can't easily recognize this gas gangrene condition, and usually it is diagnosed at when there will be like micronecrosis. Now let's talk about some of the treatment methods that can be used. The treatment, it is usually done by debridement. It means like removal of all the damaged tissues, wounds and necrotized parts, and cleaning the wound. And excision means also like removal of the skin, tissues and other body parts that is that can cause infection later. So we will make the wound very clean and clean to prevent further infections. Then amputation necessary in many cases, because if necrosis occurs, this is irreversible condition, so that we should do amputation, or it can leads to further other complications as well. So water soluble antibiotics such as penicillin alone are not effective, because they do not penetrate ischemic muscle sufficiently to be effective. As we already told, this anaerobic bacteria, wherever they cause damage, this area they will make it ischemic, and where there is no oxygen because of these toxins. And penicillin is effective against C. perfringens, but when gas gangrene occurs in such regions as the abdominal cavity, the patient can be treated in hyperbaric chamber. That means it is a chamber or the place where the pressure is very high, which contain pressurized oxygen rich atmosphere. Oxygen saturates the infected region and thereby prevent the growth of anaerobic clostridium. This bacteria clostridium, it is an anaerobic bacteria and cannot survive in oxygen condition for long period, and they will die, and we can prevent the further infections. So now about prognosis. Gas gangrene left untreated is potentially very fatal condition, and early diagnosis of this type of infection and species that cause infection will improve prognosis tremendously. Also, like preventive measures that can be employed through the medical facilities to prevent bacterial infections in patients. Also, reducing the susceptibility of infections will promote better prognosis. It can be done by practicing like good hygiene and prevent the contraction of disease which produce hypoxia or immunocompromised stage. So we should better take care of the wounds, or after surgical operation we should keep the wounds clean, so that we can prevent this kind of opportunistic infections. Also, following the resolution of myonecrosis, patient will often require further care following the deleterious effect that's caused by infection. Skin grafts are often required following the removal of necrotized tissues. The former patients will still require hyperbaric oxygen therapy to prevent recurrent infection. So these are the prognosis, and usually if this disease is found more early stage, it has very good prognosis. Thank you. This is all for today's video. I hope you guys got some idea about what is gas gangrene and how does this disease occurs, their symptoms, diagnosis, then treatment, etc. If you like this video, give it a thumbs up and share with your friends. And before you leave, don't forget to subscribe to the channel and hit that bell icon, so whenever I upload a new video, you will get notified. So we will see you in the next video. Until then, take care, stay tuned and stay healthy. Goodbye.